the Medical AI Podcast.
Hello, I'm Dr. Felix Beecher, and this is the Medical AI Podcast, a 30-minute thrill ride of big ideas. We talk to a range of top guests, from industry innovators to scientists to philosophers. This is brought to you by Omdia and Informatech, where I'm the head of healthcare technology. CT and MRI produce images of internal organs that are stunning in their clarity. Not only that, they are used extensively in medical diagnostics and therefore they save lives. However, CT involves a very real risk. CT scans involve significant exposure to ionizing radiation, with a routine abdominal CT having the equivalent of something like 3 years of average background radiation. Also, MRI involves a noisy, claustrophobic environment that can be very stressful. So, one of the key issues in medical imaging is how to reduce the radiation dose or scan time without compromising image quality. That is what we're going to be discussing today. MedicVision is a company based in Haifa, Israel, and Dallas, Texas. It was founded in 2006 and produces AI-based systems for enhancing the quality of CT and MRI scans. And joining me is the CEO of MedicVision, Eyal Aharon. Eyal, a very warm welcome.
Thank you very much. Thank you for having me.
So let's talk a little bit more about the problem that MedicVision is addressing. Could you explain more about that, what that problem is and why it is serious?
CT radiation is a serious issue. Not many people know, but one CT scan is equal by the amount of radiation that is exposed by the patient to about 300 X-ray shots, and that's quite a lot of radiation. And there were several studies about that, but there's one that was published in the New England magazine several years ago. And then was found that about 0.5% of the cancer cases in the US are resulting from CT scans that those patients were having in the past. With MRI, it's not so much about radiation, but the MRI scan is very stressful to many patients, especially people who are at risk from cancer or elderly people that have to stay still without any movement in this claustrophobic, noisy machine for half an hour or even 1 hour. Very unpleasant situation. These are the things that we're trying to solve.
Okay, I mean, that statistic that you just quoted is kind of shocking. I think would shock most people, right? 0.5% of cancers in the US being caused potentially by CT. I mean, I think that would surprise people. All right, well, let's talk about the systems that MedicVision has developed to address these two problems with CT and MRI.
So I would say just before that, what we do is we're essentially a software company, and we provide software-based solutions for providers of medical imaging, whether hospitals or imaging centers, allow them to offer better medical services and improve their efficiency, productivity, and safety of the services they provide. And specifically about those two problems that we mentioned, we have two product lines, one for MRI and one for CT. Our Safe CT product enables a reduction of the CT radiation that is exposed in CT scans, and we allow a reduction of about 40% of the amount of radiation. And to that, we also added other supporting products that report those levels and allow them to the customers to comply with recent initiatives and regulations related to CT radiation. For MRI, we have a product that is called IQMR, Intelligent Quick MR, and that one is allowing the reduction of scan time in MRI, again by 40%. And with that, again, the hospitals and imaging centers can offer better service, better MRI service, and they can improve the efficiency and patient's experience.
I see. All right. Let's cover a little bit of background on your business. So your customers are hospitals, essentially, right? In other words, owners of CT and MRI equipment. Is that correct?
Well, hospitals and private imaging centers.
Right.
Many in the U.S., almost half of the scanners are actually owned and operated by private imaging centers, not necessarily hospitals. Um, but yeah, whoever we say that whoever operates a scanner, even one scanner, CT or MRI, is a potential customer, and we have customers ranging from people with one scanner all the way to the large and known hospitals such as Cleveland Clinic or Cedars-Sinai, or companies like Radnet in the US that has more than 300 scanners and everything that is in between.
And so where do you operate? What kind of global reach do you have?
So I need to give you some background.
Yeah.
We actually started in the US. Uh, that's because the whole issue of CT radiation was raised or elevated or placed in focus back in 2008, 2009 in the US. So we started there, and then after we came out with with the first CT product, we then started working in other markets, initially Israel, our hometown, home base, and then Japan and Europe. Um, and when we started working on MRI, which was like 5, 6 years after the CT, an interesting thing happened to us. Um, Radiation in CT is valued mainly in, I would call it, well-developed countries, USA, Europe, UK, Japan, places like that. In developing markets like China, for example, um, there's a significant shortage in the number of scanners that they have. So no one cares about radiation. Okay, it's maybe not nice to say so, but if someone gets an appointment for a CT scan, they just take it. They won't ask what the radiation levels that they would get. In MRI, however, we found, and we didn't know that when we started, but we found that the value of the short scans is even higher in developing markets compared to, again, USA or the UK. In the US, for example, there are 12,000 MRI scanners serving approximately 350 million people. In China, they have about 8,000 scanners, so much less, serving 1.5 billion people. So there's a desperate need for scanning capacity. And a product that allows almost doubling the throughput of the MRI, allowing to scan much more patients at the same time, is priceless, I would say. In places like that. And when we came out with the MRI product, we expanded to from our, let's call it, traditional markets, USA, Japan, and Israel, and we see great success in China, Brazil, Korea, and other developing markets.
I think then there are two distinct benefits to these kind of AI systems, right? The first is that you make the experience of the scan, in the case of MRI, more pleasant, in the case of CT, more safe. And from the point of view of the hospital, you increase the productivity of the machine, right? Is that fair?
Yes, correct.
Okay. All right, well, let's dive into a little bit more detail onto how these systems actually work, because, of course, AI is one of those buzzwords that sometimes gets used in a fairly meaningless way. So let's talk about the AI component to these
So
products and how, yeah. Mhm.
first, I think I would take you through a short tour on the how we developed our products and technologies. And AI is, we've been in business for what, 14, 15 years now. And AI came out to the world, I don't know, 3, 4, 5 years ago. We started way before that. We started with developing legacy image processing technologies for image enhancement. Um, Again, we started with CT, and the reason we started with that, and I'm moving away a little bit from the uh, technology, but I think the way we our products and we as a company evolved are part of the answer that eventually, you'll get a better understanding of the whole thing. Um, we started in 2008 when there were several reports about Cedars-Sinai Medical Center in Los Angeles investigated for overdosing patients. And you can Google and find it after that, but I can still remember a picture of a 2 years child who lost his hair because of CT overdosing. And we said, you know what, this is something we can solve or we can help with. And we developed, as I said, legacy image processing technology that was advanced at the time, no AI at the time, to help reducing the CT radiation. And you know what? Our first customer was Cedars-Sinai, and they equipped all their CT scanners with our Safe CT at that time.
So that's
So
a
that's where we started.
yeah, that's really interesting. So that's a pretty scary story. This kid who got the radiation overdose in Cedar Sinai, was it an accidental overdose? In other words, was the dose of radiation more than it should have been, or was it in accordance with protocols?
There's a debate about that, okay? But there was no warning or any indication to the operator, the CT tech who operated that thing, that he or she, I don't remember, who was it specifically, well, if they were overdosing the patient, the specific patient, okay? They did what the scanner allowed them to do, and they didn't get any indication that it's something,
Yeah,
too high, if you will,
right.
and should be prevented. That was one of the things. And by the way, this led later on to another requirements, for which we also developed a product that prevent this kind of error or mistakes. So today, if you are running our systems on your scanner, first, as I said, you can reduce your CT radiation, but also if you, by a mistake or by whatever it is, getting to levels which are too high, we are going to, our products are going to inform you of the situation. And not just that, they will even prevent you from continuing the scan unless you approve that this is really what you want to do. Okay, so that's how we cover this whole thing of CT radiation risk. So now in 2015, we were thinking about, okay, what's next? We've done all the thing. We had hundreds of customers at a time using our CT systems, and we said, okay, what's next? And there was a personal issue then. I had a severe low back pain that I had to go through an MRI, and the earliest appointment I could get in Israel was in about 6 weeks. And I thought that, that doesn't make sense. And I checked around, and I saw that while in the US you can get an MRI appointment the next day, in many other countries the wait time is much longer. From my knowledge, I'm not an expert, but from my understanding is that the wait time in the US, in the UK, is about 3 weeks. In France and Canada, it's over 1 month, and same in other countries. So, and that's just an MRI appointment, right? We're not talking about cardiac surgery or something. This is something that should be available for everybody. And we said, it doesn't make sense. And then we said, let's take the technology that we already had for CT, let's add AI to that, and let's see how we can reduce the scan time in a similar way to the way we reduce the radiation in CT. So that's how now the AI came in and join, if you will, the legacy technology that we already had to come with the MRI product that combines both AI and legacy systems working together. And in 2018, we came out with the IQMR product that allows reducing MRI scan, as I said, with what we call a hybrid system. So it has multiple software packages. Some of them are AI algorithms, and some of them are legacy, quite advanced image processing modules, and they all work together to provide the performances that we are currently providing.
I see. Now, if let's compare two radiologists. One gets given a conventional CT or MRI scan produced under normal conditions, and the other gets given a CT or MRI scan given with your system, in other words, with a 40% reduction in either radiation dose or scan time. Now, are those two radiologists going to see any difference in front of them?
So our claim to fame, which we've proven by I don't know, hundreds of radiologists who already tested and have been working with our system is that um, they cannot see the difference. Okay, they get two images. That's, by the way, something we did before we got the FDA approval. All kind of other tests that we did for getting other approvals in other countries. But every implementation that we do, we take some sample scans and we do this exact test. So we take a volunteer, we scan them first in the standard care, if you will, standard routine, and then we do another scan with a short protocols. We process the short protocols, the images that were acquired by the short protocols, and we give it to the radiologists in a blind way, so they cannot tell the difference, which one is which, and we task them, tell us what you think, and if they can tell, we're essentially done. We proved our case.
Yeah. Okay, let me explore an analogy with you, because essentially what you're doing is you're taking poorer image data and you're cleaning it up and producing something that looks as good as what you would have got with a a more detailed or longer scan, right?
Mhm.
Now, here's an analogy. Let's imagine that sometimes we see programs which are used to clean up old photographs. Simple algorithms can find a scratch in a photograph and they can fill it in using the colors right next to it, for example. And what you end up with is a cleaned up photograph that looks as though it doesn't have a scratch in it. Now, is that a reasonable comparison to what you are doing with the CT and MRI scans?
It's an analogy, and I'll answer that. I agree with you that first I think it's a very good question and a very common concern. Okay, because as you said, eventually it's a series of estimates. It's not, no one knows what real data is, when it's inside the body and you cannot see it, right? Um, and uh, there's several answers to how we deal with this issue or concern. Yeah, and I agree. If you have a picture and you have a scratch on it and you want to remove it or refill it, if you will, you estimate that something was there before, and then you fill it in as you think. Uh, in this case, you can think that what we do is somewhat different, somewhat similar, because we take a low quality image and we make it nice and clean, right? But it's not as easy and not as simple as that, because essentially there are two things here. One is we do not analyze a specific image. We analyze the entire volume of the scanned body part, a head or chest or whatever it is, a hand. Okay, so what it is actually is not just one image, but a set of 30, 40, 50 images that are just coming one after the other in a certain direction. If I use your analogy, think about this picture that you were talking about, and let's assume that this is only one shot from a series of, I don't know, 20 or 30 pictures that were taken just one right after the other, for example, every 1 second. Okay, so if you're now in picture number 12, and there's this scratch that you're looking for, well, the first thing you would do is you would go and check what happened before and after, in image 11 and 13, and see if the scratch appears there, right? If the scratch is there, it's probably real. If the scratch is not there, it's probably just something that happened to the photo that you're looking at, right? We do the same with our CT and MRI products. We do not analyze just one image. Actually, we're looking at the entire brain, for example, or whatever the body part it is,
Yeah.
and we are not analyzing each slice or picture, but every volumetric pixel, every voxel is compared to anything around it, and we also use similarities and symmetries. For example, if you analyze the left ear, you can see how things are looking at it at the right ear, for example, or there are some other symmetries in the body. And by looking at all the body parts with all the symmetries and all the functions and the characteristics of the entire body, you're looking at 30 images, not just one. That's how you can make a better decision whether something is real or not.
Okay.
The second thing that I'd like to say here is that, as I already mentioned, this is not a pure AI system. Okay, this is actually a combination of AI and legacy modules. And well, the AI provides excellent image quality. The legacy system enhances certain parameters. For example, it may enhance edges and stuff like that. That it was that we developed it to do, but it also, in a sense, it keeps the AI modules in check. Okay, that's how we control that the AI machine will not just go whack and then start, getting some weird results. The legacy systems keeps everything stable, if you will, and
Yeah.
that's how it makes sure that things of that shouldn't be seen are not happening.
Okay. Look, I want to press a similar point a little bit further, not too far, because it sounds to me like what you've developed here is a very important solution to a very important problem. But let's imagine that your systems can clean up CT and MRI images and make them look very good for a human radiologist and might perform very well in clinical tests in human radiologists. However, what you're doing nonetheless is, as we discussed, losing a bit of data that we think is false data, but could and will in some cases be real data, right? So you will be losing a little bit of real data. Now, AI systems that are being used to diagnose disease on the basis of MRI or CT scans might be using a bit of that data that you're losing with your systems. In other words, AI systems potentially could be performing not as well on images that have been cleaned in this way. Is that a possibility?
There's always a possibility. It's not a 100% sure that nothing is. You cannot guarantee that nothing happens. Shit happens sometime. What I can say about that is that whether it's the AI system that performs the diagnostic or a real human radiologist, it's the same thing. The concern is shared by the radiologists themselves as well. Every place we go, they always ask us, how do I make sure that we're not losing anything or adding anything to the original image, right? Then, regardless whether it's a radiologist who's doing the diagnosis or a machine. And you know what? The FDA was actually the first one who asked, and we had to prove that that doesn't happen. And the way we proved it is by using phantom tests. So the first thing we did is we tested the product using phantoms, which are, I don't know if everyone knows, but these are plastic things with a very specific dimension and structure, and you know what's in there. So you can very well measure whether all the components are in there, if they are seen correctly or not. So that's the first thing we did. The second thing is we did quite a lot of tests with cadavers, and all that before we started with human tests, and then we presented everything to the FDA and other regulatory institutes, by the way, and that's how we verified and validated that the risk that you're saying is essentially not existing.
What other regions of the body do your systems get applied to?
Well, we started with brain because brain is about 25 to 30% of all MRI scans. But by now we then moved to spine and then to joints, knee and hips and all that. And by now we support all body parts, including complex ones like prostate or cardiac or anything in between. So really every body part, every procedure, by the way, with contrast, without contrast. It works with everything. And also, not less important, is that we also support all scanners. So, obviously the big five, I would call them in the medical imaging, GE, Philips, Siemens, uh, Toshiba, Canon now, and Hitachi, Fuji now. But also when we started in China, we were exposed to all kind of vendors that we were not familiar with before we got into China, and it works with all scanners as well. So all body parts and all scanners.
And do the systems use the same processes for each body part, or do you have to retrain your systems for different body parts?
So we had to our system do not have to be trained when they are already deployed. Okay, they are trained in advance, if you will, because we do. It relates to what you asked before. So before we say that we can support prostate imaging, for example, we had to do all the tests that I just mentioned with phantoms and with cadavers and humans and everything before we declare that this is can be used in real patients. Okay, so the training is done in our lab before the system is actually released. Once it is released, it does not have to be retrained again, which is sometimes the case in some AI machines. Not in our case. But for each body part, we had to train the machine because, as you can imagine, a prostate imaging looks totally different from a spine. So we had to train them for handling all those body parts.
One of the main problems people talk about in AI is how to ensure that AI systems are not subject to bias. Is this something that you have considered? Is it something you have been required to consider? And how did you address this kind of issue?
So we had to consider it because it's a common concern, and we've been asked about it. But fortunately for us, it's not really relevant to what we do. Because as you mentioned earlier, we are not doing any diagnostic per se. Okay, we leave it to other people. We are not looking for to identify certain features or clinical findings that are maybe more common in or rare in certain populations. What our system is trained to do is to bring an input image, typically a low quality image, to a standard high quality image, and therefore it's not really affected by ethnicity or gender or age or any similar factor. That's just the basic design of the system. But also here again, we have some benefits of being in this business for so many years. Um, we started developing as I mentioned earlier, the AI modules for MRI after we already had the, the basic CT product deployed at hundreds of hospitals mainly in the USA. And what we did is we asked our customers to help us by providing anonymized, good quality sample images so we can establish what we call the reference high quality images. Okay, and we got them from different countries, from different parts of the world, obviously different genders and ethnicities, different populations. So by now, with over 500 systems deployed worldwide, I think we can certainly say that we cover all populations and all variety, if you will. And the last thing that I already mentioned, and I will mention again, because I think this is at least my belief. Okay, I think that the the most important thing is to have a combination of AI and other technologies as well. I think pure AI system they have very well known benefits, but they also have some concerns. Some of them you mentioned, and other concerns of stability and reliability, and the need to retrain in certain cases. Okay, so for MedicVision, in all our products, we always combine AI with legacy systems, and the legacy algorithms keeps the AI modules in check, even if now we're starting working with populations that we never heard of or we never encountered.
One problem that people complain about in this sector is the rate of adoption because people are all over the world are developing exciting, apparently very accurate diagnostic systems for all sorts of reasons, and also systems like yours. What challenges have you experienced in terms of adoption?
So I think and, I see it around, and um, there's so many. If you go to RSNA every year, you see, I don't know, hundreds of companies with AI solutions. But I think that there are two main things that are very important when you even start thinking about developing or using an AI or any other new technology, by the way. And that's one thing is the product must have or can provide a measurable value to the customer. And the point is measurable, okay? Telling someone, oh, it will be nicer, it will be easier, or all kind of words like that, it just doesn't work. Okay, maybe it used to be in the past, not in this era, if you will. Okay, the value must be measurable. The return of investment must be clear. And I think that one of the main problem with some of the AI tools is that they cannot see a clear ROI on the product, which is, by the way, for us very easy to do because we count how many patients you did in MRI before we came in. We count how many patients per day you do in MRI after we implement our product. We show you an increase. You can multiply by the number of by the amount you get for each scan. Here's your ROI. Very very simple to show. Okay, so that's one thing. The second thing is that also is sometimes I would say forgotten or not maybe overlooked is that the AI system must be integrated with the other systems at the hospital or imaging center. Okay, it's not a standalone tool. If it's a standalone tool, it's not going to be incorporated in the workflow, and it's just not going to work. I can give you an example from our experience. So we come to a site, and let's say we reduce the scan time by 35%, which is very nice, and everyone's happy. Okay, but if the hospital really wants to leverage this capability, then you have to integrate these new scans into your scheduling system. So instead of giving or opening three or let's say two MRI appointments per hour, now you can do three. So if it's not integrated with your scheduling system and with your RIS, then the fact that the scan time was reduced by even 35% is nice, but there's no measurable value. If it is integrated, you can certainly show the measurable. You can measure the value, you can calculate the ROI, and now everyone can use it and be happy. So these are, I think, the main two things that both customers and vendors should remember: measurable value, ROI, and integration.
Okay, good. Eyal, last question, and that is, what is your favorite example of medical AI currently used that's got nothing to do with your own?
Well, before, maybe not many people know, but you asked me similar this question before, and since we talked, I don't remember, a week ago or so, I've been thinking about all kind of other applications and what I like more and what's less and everything. And there is one that came out very clearly in my mind, and that's a company called Imagine. Imagine, like genetics AI, Imagine AI. That's another Israeli startup. And they use AI and image processing technologies, by the way, also some kind of a hybrid system that combines both AI and image processing to detect biomarkers for cancers in real time. And this is a broad statement, maybe, but what it means is that if you can identify those biomarkers in cancer, and you don't have to send them for biopsy or gene analysis that takes sometimes weeks, and you can have an answer, within an hour. It really can revolutionize the cancer treatment and actually open ways for precision medical treatment in cancer that is not open today. So Imaging AI is the one that I would recommend looking at.
Excellent. Okay, well, it's exciting times. Eyal, thank you so much. It's been an absolute pleasure talking with you.
Thank you. Thank you again.
Talk to you again. Bye-bye. Thank you for listening. I'm Felix Beecher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.